Good morning, everybody. My name's Nguyen and I'm an intensive care specialist at Nepean Hospital, and I've also been involved with the health team in the response to COVID-19. So we've been preparing for the last 18 months, almost 20 months. So I started in March of 2020 when we were called to action and worked part of this whole team to get our intensive care units ready with our clinicians and equipment. We have the equipment ready. We have our staff ready. And our staff have been meeting every week whereby they share insights. And our Sydney-based doctors and nurses are also helping the rural and regional New South Wales team. We're really fortunate to work in a health system that's well coordinated and resilient, and it's world class. But what's worried us over the last few weeks is the increasing number of patients who are admitted to intensive care, and they are younger, they are staying in intensive care for longer, and they are needing care that can't be provided anywhere else in the wards. There are those who are on breathing machines and on heart-lung machines. And what has really worried us is the number of young patients who are coming in. So up to 25% of them have been less than 40 years old. Our nurses and doctors provide the best and compassionate care, and we need your help. So we know that it's difficult at the moment. We know that it's hard that your families don't get to come in and see your loved ones in the intensive care. So when Dr. Gale talks to the 100 patients with COVID who are in intensive care units, there are another 400 who are in there for non-COVID reasons. And at the moment, you can't go in to visit them. Our nurses, who are the backbone of our healthcare system, are providing care that's compassionate. They're holding their hands and they're comforting them because we know that you can't be there. And this makes it really hard for the community, and it makes it hard for our nursing and our medical staff across the whole hospital. We are worried about the increasing number of patients who are admitted to the wards because we know that at some stage they will need the care of the intensive care team. It's not a good day when you have to meet the intensive care team. Okay? We would much prefer not to ever meet you and your families. Our nurses are coming and our doctors are coming up to work every day despite knowing how difficult it is. They're leaving children just like you at home, and our call is to please get vaccinated. We know that vaccination decreases your risk of getting severe disease. We know that vaccination decreases your chance of death. And we're here to call to ask you to help us. Our nurses and doctors are committed to providing care, and care in times of normal times, let alone the pandemic. And we really are genuinely asking for your help. So although I stand here as a representative of the intensive care community across New South Wales, I'm going to send out a personal message to those in the southwestern and western Sydney. I grew up in Liverpool and I now live in the Penrith LGA. So please, if you're able and you're between 16 and 39 years old, book in and get your first shot in the vaccine because we know that it will protect you. And as I said, it's a good day when you don't have to meet me or any of my intensive care team. Thanks.